All right, let me begin by saying the future is now. All right, so when sensor networks first started, everyone's saying, well, where are the applications? Are they really used? Is anyone really going to be using them? And I'll claim that SensorNets for home healthcare is in fact underway. It's still early, but it's underway. Lots of examples of systems that have been deployed. Now, I've been working in this area about 10 years, just on home healthcare. And what I want to do in today's lecture is at one level give you an idea of 3 or 4 applications that we've been using so that this is the value to the medical community. However, we're computer scientists and engineers, and we want to understand that there's technical problems underneath the covers. And so what are the research questions and research solutions that you need in order to achieve these kinds of applications? So I will talk about, hopefully have time for 4 different solutions, 2 of which were completed and 2 of which we're currently doing. Now, before I begin, though, when we say SensorNets for home healthcare, first of all, everything has to be wireless, all right? Otherwise, our house will look like this, all right? And we don't want that, all right? So no wires. And worse than looking like this is we don't really want people to be tethered to wires, right? I mean, you could put EKGs on people and they're tethered to some kind of machine that reads it. No, person should be able to go about their daily habits more or less like usual, and so not being required to be tethered to any kind of wired device. So I'm going to spend just a couple minutes on the problems in vision. Those of you who work in this area, this is all common knowledge, but to set the stage, I think a few slides telling you what the real problems are. And then I'll talk about some of the applications we're doing and then the underlying technology. So the problem is that the world has a rapidly aging population and there's a very high cost of medical care. So the projection is there are not enough facilities. There are not enough assisted living facilities, not enough nursing homes, and they can't be built fast enough. And besides that, people don't want to go there. They want to stay at home. So that's the real issue, quality of life, keeping people at home as long as possible. And the solution is really home health care. But it also applies to what's called continuous care retirement communities. So people go in healthy, and then as they age and they get more and more sick, they get more and more services. And then assisted living. I think the technology we're developing for home health care also applies to these other areas. So the basic issue is the vision is a smart space, right? So here we have an apartment, and we might have sensors in the bed to